Now, unemployed pharmacists are today set to march outside the health department's offices demanding action. Approximately 2,000 pharmacists in the country are jobless after completing mandatory community service, citing the government's failure to create jobs. In fact, they'll submit a memorandum to health officials and have gathered over 500 signatures on a petition that's stressing urgent need for government intervention. Watching that story is SABC News reporter Molemo-Waone, who joins us now live. And Molemo, I understand you spoke to some of these unemployed pharmacists. What are they telling you?
Good morning, Ayanda, and good morning to the viewers as well. Indeed, we are here at the National Department of Health, where a handful group of unemployed and community service pharmacists, have gathered to just protest against the lack of employment opportunities in the country. And they, as you have just said, are lamenting the fact that over 2,000 of pharmacists in the country's health sector are unemployed. And for a long time, the government has also, ignored their plea. It has just, turned a deaf ear to their plea. But just to hear more on that, I'm going to be now joined by the spokesperson, Trevor Ngobeni. Trevor, you are here today. Just tell us, why are you here? What are the concerns?
So we're basically gathered here as a group of pharmacists that represent over 2,000 pharmacists in the country that are protesting against the lack of employment in the country. And this is at a time where we have the least amount of pharmacists, as our colleagues all over the country are understaffed, so much so that they are giving the responsibility and they're delegating the scope of practice to nurses and dispensing doctors, as was the case when there were a little or shortage of pharmacists. But we now have a surplus, and the government will not unfreeze any posts because there are multiple posts all over the country, all over the public institutions that are yet to be filled, but the government will not unfreeze those posts. Hence, basically, we have a healthcare population, rather, or people seeking healthcare that are not being served, because we've got one pharmacist that is serving about 12 individuals in the public care space, basically. So what we are basically gathered here to do is to hand over the memorandum to the Minister of Health. Not only are we handing it over to the Minister of Health, we're handing it over to the President or Registrar of the South African Pharmacy Council to basically address that and ensure that they also modify the regulations as to ensure that they actually stand for the pharmacist and they consult stakeholders to basically make employment for pharmacists. Basically ensure that they unfreeze all of the posts across the country, because billions and billions of taxpayer funds have been spent on putting pharmacists in school using government bursaries, internships, as well as community service. And now that we are supposed to serve the nation, we are being told that we must go overseas, we must go to private, the very same private sector that is not hiring us right now. So we call upon the Minister of Health, we call upon the Director General, the South African Pharmacy Council, for regulation and reform of all the Pharmacy Act laws, as well as the private sector, to please ensure that they focus and intensify the recruitment of pharmacists, because pharmacists are the backbone of this profession. Yes, we do have pharmacy assistants, however, those people are secondary to pharmacists. So we found ourselves in a situation where the people who are at the backbone of basically the industry are being discarded, and we are basically finding a situation now where they are using our colleagues who are pharmacy assistants to fill those gaps. And unfortunately, those people have only a limited scope of practice. We respect them, we love them, however, they are understaffed. They need hands, and we need more people on the job. So we need the government, as we're approaching the budget speech, to ensure that they revise that now more than ever, that they increase the budget that is directed to the Department of Health, as well as increasing the budget that is directed to pharmacists at large, and ensure that we see a record number of posts being opened all over the country for pharmacists, as well as posts being opened in CHCs, which are clinics all over the country for pharmacists, because those are areas that need pharmacists the most, because we find ourselves having nurses that are dispensing, which are basically conducting a lot of, or rather committing a lot of mistakes, which result in the state being sued. And we have medical clinical cases that Dr. Mothoa was addressing. Those funds could be used to fund all of these posts that we are currently addressing, if only we could address this matter and avoid all of those cases against the state. So we call upon all of the stakeholders to please treat this as a national crisis and intervene before we lose all of these critical skill workers. That is our cry from the Union of Pharmacists, that is Unemployed. We also have support from your unions such as Mothoa. So this is not the end. We will be hitting all of the provinces in the country in the next few weeks to come. So we will be handing over memorandums to all of the MECs all over the country, as we will be handing over to the minister today, as well as the Registrar of South African Pharmacy Council. So we call upon the public to also join in on this, because they are the ones that are being undercutted from their tax-paying money by actually being underserved in clinics, hospitals, and all healthcare facilities. So we call upon them that this is a problem that affects them as well. We please ask that they raise they spread the word so that the government can hear that this comes directly from them. We are here to serve them. We ask that they serve with us. Thank you so much.
Just briefly, how is this individually, impacting you, impacting your...
So we found ourselves in a situation where we've basically gone to school for 4 years. We've done training for 2 years, which is your pharmacy internship and your community service. Now we find ourselves at home. We are unable to practice. We are basically have families that are looking towards us, and we are unable to fulfill the needs of those families as well. More than anything, our skill and our profession is being diminished. So as an individual sitting at home, everything, all of that training that you have undergone is going out of the window. So it is very alarming for someone such as myself to be sitting at home when there are so many posts that need to be filled out there. So it is also affecting our mental health as a profession. It is also affecting our patriotism, as we're losing faith in the state. And yes, it's taking a huge toll on us.
Okay, thank you. That's Trevor Ngobeni. They also are yet to deliver or rather hand over their memorandum to the health officials. And that's back to the studio.
All right, Molemo-Waone, Mothoa, live to us there from Johannesburg. Thanks very much indeed.